think for years, individuals worked in the mines with very little knowledge of the effect that the exposures, the things that they were being exposed to, were going to create these illnesses.
Miners are currently a clinically underserved community in the United States. There are very few research studies that have been done on miners of good quality. In order to improve the clinical care of miners, it is very important to do good clinical research studies on questions that really are important and relevant to miners and their communities.
The feedback that we got in the past was that researchers would come to the community, they would come out, they would do their work, and then they would return, and they never received any feedback. There was never any follow-through, and they never heard any of the results. And I think that was the one thing that was important to them. Don't just come out here, collect your data, and go home, but collect your data, report back to us, let us know what the outcomes were, and how can we benefit from the research that you're doing here.
We know that mining communities welcome research. We also know that mining communities have some concerns about confidentiality and storage of biological specimens.
So we're studying miners in mining communities or throughout New Mexico who need access to care either through a mobile or a fixed unit for type of health issues that we see in miners.
From the beginning, we have been intimately involved with the miners and the mining community. We have gotten funding from an organization which is called PCORI, which is Patient-Centered Outcome Research Initiative, which demands that the people that you're studying are actually contributing to the research and are part of the decision-making process and the priorities and that sort of thing. And we are really committed to that. And that's a little different than some research teams, but we have a broad spectrum of expertise, everything from benefits counseling to screening, a screening mobile van that goes around the state, to a pulmonologist, to someone like myself who's a cancer epidemiologist who really focuses on population-based research. This team, the strength is really our team and the fact that we really do believe in the participation of the community with our research.
Obstructive lung diseases include asthma and emphysema. Emphysema is also called COPD or chronic obstructive lung disease. Restrictive lung diseases usually include things like pulmonary fibrosis, and pneumoconiosis is often considered to be a restrictive lung disease. It has been long thought that miners who get exposed to a lot of dust at their occupation go on to develop restrictive lung diseases such as pneumoconiosis and pulmonary fibrosis. Our preliminary findings suggest that that is not the case, that most miners go on to develop obstructive lung diseases such as COPD rather than restrictive lung diseases.
I think they want to be acknowledged that, hey, I put all this time in the mines, I was exposed to all these toxins, and I'm sick, and I want to one, understand my illness, how do I manage my illness, and more importantly, prevent it from happening in the future.
With Miners Colfax Medical Center, that's one of our missions, and the University of New Mexico, to look at miners' health and to find service center delivery systems for those minor health problems.
It's important for the miners that our educators and our physicians and our policymakers understand the disease process here in New Mexico, so the treatment that they receive is more appropriate to their diseases. One of the things PCORI, I think, is interested in is that not only are we advocates for the patients, but the patients are advocates for themselves.
So some of the preliminary findings that we've found are that communities are very engaged in their health. They're very interested, the miners are interested in their health concerns. So our next step is to go ahead and apply for Tier 3. That will help us continue the project, continue getting community engagement, continue to build our stakeholders, our networks, and it'll help us to be able to build tools to go back into the community and see how we're going to disseminate what we find, how to build new services, service lines for those communities, and exactly what's needed in those communities.
So anything that we can do to study the causes of cancer, to reduce those exposures, to get early screening, early treatment, and appropriate care for people who then are diagnosed, anything we can do in that arena is going to reduce the burden of this disease.
After spending so many years working with the individuals in these communities, I've come to actually develop relationships, long-term relationships, and I think it's important that they know that we're continuing our work, whether that's by me or by somebody that comes after me, and that we're not just walking away from this, and that we do care about the community, we care about the state, we care about the lives of the individuals that worked in this industry.
The University of New Mexico and Miners Colfax Medical Center are committed towards providing excellent clinical care and continue to do high-quality research in miners.